In today's society, body image is heavily emphasized. The media and people set out a standard of how men and women should look, shaming those who aren't skinny or thin. The unrealistic expectations influence people to do whatever it takes to meet that goal. This is when disorders like anorexia develop. Anorexia nervosa is defined as an eating disorder that causes people to obsess over their weight and restrict food consumption. Oftentimes, people will have a distorted perception of their own body and weight. There are obvious physical symptoms of anorexia nervosa, in addition to the emotional and behavioral symptoms that come with the disorder. Physically, anorexics appear to be abnormally thin and often experience fatigue, insomnia, fainting, or dehydration. As the body deteriorates, the blood count goes down and heart beats irregularly, and blood pressure drops while hair thins or breaks off. Anorexics may experience constipation, intolerance to the cold, and swelling of the limbs. Behaviorally, those suffering from anorexia will diet or fast excessively while exercising compulsively. Additionally, they will binge and purge, binging food and then voluntarily vomiting to get rid of the food through laxatives or diet products. A change in attitudes and moods is visible as anorexics will socially withdraw themselves, express less interest in stress, and display a depressed mood. Anorexia has the highest mortality rate in any mental disorder due to starvation and suicide. Over time, these detrimental symptoms deteriorate the body, making the disorder so dangerous. Much like the symptoms, there are physical and emotional consequences. Anorexics could develop heart issues like arrhythmia or heart failure. Bones become weaker, increasing the likelihood of breaks and fractures. Gastrointestinal problems like constipation, bloating, or nausea are also common. Emotionally, anorexia could lead to depression, anxiety, personality disorders, OCD, and the abuse of alcohol and drugs. Though there are no direct causes to anorexia nervosa, there are biological, psychological, and environmental factors that contribute to the development of the disorder. Biologically, there are no genes that connect to anorexia. However, certain tendencies are associated with the disorder. Those that have perfectionist, sensitive, and persevering characteristics are more likely to develop it. Psychologically, emotional factors may influence one to restrict their food consumption. Younger women are more likely to have obsessive-compulsive traits, making it much easier for them to dedicate themselves to a set diet. Additionally, anxiety could cause one to constantly worry about their weight and body image, forcing them to binge and purge. In terms of the environment, today's Western culture glorifies skinniness. Young girls are especially vulnerable to the peer pressure of meeting the certain expectations. Research points to factors that increase the likelihood of developing anorexia nervosa, including gender, age, and careers. Anorexia is more common in females than in males. However, that does not mean that men do not have it. In fact, the rate of men with anorexia has increased due to social pressures. The disorder is also much more common in younger people. It is rare to see an adult over 40 develop it, though it is possible. Teens undergo puberty and experience peer pressure, making them much more vulnerable. Those who are involved in sports and artistic activities are more likely to be anorexic. Athletes, actors, dancers, and models all have a standard to meet. Despite the abundant amount of research, there are still no ways to completely prevent anorexia nervosa. The best way to stop the disorder from developing is by catching the symptoms early and prevent it from progressing or developing fully. Red flags include skipping meals, frequently checking the mirror and weighing themselves, calluses on knuckles, eroded teeth, and the layering of clothes.
Oftentimes, anorexia is associated with bulimia, but not all anorexic people are bulimic and not all bulimic people are anorexic. In fact, some people who are bulimic are actually either obese or at a normal weight. There are many misconceptions about bulimia, so let's take a look at what the psychological disorder really entails. Bulimia nervosa is an eating disorder that typically affects women between the ages of 8 and 60. It is characterized by excessive overeating, or binging, and then induced vomiting, or purging. Purging is done in order to manage weight while still having the benefit of eating, and to some people, this may seem like an easy way to lose weight, but it can be very dangerous. Frequent cycles of binging and purging can put severe stress on the body. The heart is not built to withstand daily vomiting, so this stress can lead to heart palpitations, arrhythmia, heart attacks, and even death. Repeated vomiting cycles erodes the enamel of the teeth, leading to yellow teeth, mouth sensitivity, and rapid tooth decay. For women, bulimia can even cause fertility problems. As a result of bulimia, it is also common to develop chronic, painful stomach problems, such as stomach reflux, inflammation of the esophagus, and gastroparesis, which is a partial paralyzation of the stomach muscles. The sad thing about this is that even after a person overcomes bulimia, these symptoms will still remain present. In severe cases, the stomach gets used to rejecting food, so it cannot keep the food down. This makes treatment even more challenging. Another issue with bulimia is drug use. Bulimia itself puts a tremendous amount of stress on a person's body, so to alleviate that stress, people tend to turn to the use of recreational drugs, adding to further health complications. The main treatment for bulimia is therapy. Here, a patient consults with their therapist and is taught how to manage stress and how to avoid the cycle of binging and purging. Group therapy is another option because a sense of community can give people extra strength to fight the eating disorder. Antidepressants can also be prescribed to help patients overcome bulimia, but this treatment is not effective for everyone. In severe cases, inpatient treatment is needed to effectively address bulimia. So, how can you tell if a loved one has bulimia? Well, there are several telltale signs. The biggest indicator is an obsession with weight and a fear of gaining weight. Also, spending prolonged periods in the bathroom after a meal can be a serious warning sign. In addition, people suffering from bulimia tend to eat by themselves and hide the evidence from their binges. If you notice an unusual amount of food waste and wrappers, it may be the result of a binge. People with bulimia who induce vomiting often leave cuts on their hands from their fingers scraping against their teeth, and red pinprick marks on their face from blood vessels popping. Bad breath and yellow teeth are also indicators of long-term bulimia. Confronting a loved one or someone you know who has bulimia is never easy, but it is a crucial step to lead them towards recovery.
Binge eating disorder is a severe, life-threatening, treatable eating disorder that is characterized by recurrent episodes of eating large quantities of food that is often very quick to the point of discomfort. This frequent act of uncontrollably consuming food is followed by powerful emotions of shame, discomfort, depression, distress, guilt, self-hate, and loss of control. Similarly to bulimia, there is an uncontrollable consumption, but with binging, there is no regular use of unhealthy measures like purging to counter these actions. The DSM-5 newly recognizes this as its own disorder, as before it was a subtype. This helps insurances properly cover it as it must meet certain criteria. To be diagnosed with binge eating, one must eat discreetly, usually within 2-hour periods, an amount of food that is significantly larger than most would eat in that similar period. To have binge eating disorder, you must partake in 3 or more of the following: eating more rapidly than normal, feeling uncomfortably full, intaking large amounts when not physically hungry, eating alone due to embarrassment and/or depressed or guilty after. These binge eating episodes last generally once a week for about 3 months and have no inappropriate counter behaviors. Binge eating is the most common eating disorder in the US. When it comes to statistics, the NEDA, or National Eating Disorder Association, conducted a study on 9,282 English-speaking Americans in 2007. The results showed that 3.5% women and 2% of men had binged during their lives, making this disorder more common than anorexia and bulimia combined, breast cancer, HIV, and schizophrenia. Another study was done on 496 adolescent girls for 8 years that followed them until they were 20 years old. It was found that 5.2% of the girls met DSM-5 criteria of anorexia, bulimia, or binge eating disorder. The researchers found that this data estimated between 0.2% and 3.5% females and 0.9% and 2% of males will develop binge eating disorder during their lives. It occurs in 1.6% of adolescent females, and out of those, 28.4% currently receive treatment, and 43.6% at some point will get the treatment. Binge eating becomes addictive due to the comfort that food offers. In the moment, food helps to ease unpleasant emotions or feelings of stress, depression, and anxiety, but when reality hits, it's regret and self-loathing. They may even eat when they're not hungry and continue to eat after they're full. The consumption can be so fast that sometimes they can't even register what they're eating or tasting. Binge eating disorder leads to weight gain and obesity, which then reinforces the compulsive eating. A vicious cycle forms of eating to feel better, feeling worse, and turning back to food for relief. Binge eating disorder is treatable as the repetitive cycle can be broken through developing healthier relationships with food and feeling good about yourself. Beginning of recovery is hard, as usually victims are embarrassed or ashamed about their habits, causing them to hide symptoms by eating in secret. There are behavioral symptoms of binge and compulsive overeating as they can't control what they're eating, rapid large amounts of food, eating when full, hiding or stocking food in secret for later, normally eating around others but gorging when alone, and continuously eating throughout the day with no planned meal times. Emotionally, they feel stressed and tense that they can only be relieved by eating. There's an embarrassment of how much they eat, feeling numb like you weren't even there, guilt, disgust, desperation to control weight and eating habits. There are so many causes through social, culture, psychologically, and biological factors. Socially and culturally, there is a pressure to be thin that can fuel emotional eating. Victims' parents usually set the stage for binging as they use food to comfort, dismiss, or reward their children. As children, they could have been received frequent critical comments about their bodies and weights, making them vulnerable, as well as those sexually abused in childhood. Psychologically, depression and binging are strongly linked, and so many have been depressed or are depressed. Also, there is a struggle with impulse control, managing and expressing feelings, low self-esteem, loneliness, and body dissatisfaction. Biologically, abnormalities are commonly seen. The hypothalamus that controls appetite, and so it may not be sending the correct messages about hunger and fullness. Genetic mutation causes food addiction and low levels of brain chemical called serotonin, also found to trigger binge eating. Binge eating disorder causes physical, emotional, and social problems. There is a risk of health issues, stress, depression, anxiety, substance abuse, substantial weight gain, insomnia, and suicide, which is found to happen more than someone without an eating disorder. In order to recover, they need to develop healthier relationships with food and break the cycle of feeling deprived, overwhelming urge to eat, binge, feeling out of control and ashamed, and then dieting to regain control. Some tactics are to avoid temptation, listen to your body, focus on what you're eating, not to diet, finding a better way to feed your feelings, identifying triggers with food, and ride it out instead of fighting it. Talk to someone. Find ways to manage stress, get enough sleep, connect with others. Beating binge eating disorder is difficult and a long road, but through help and support of friends and families, it is very possible.